You have 6 hours to reattach a body part if you want it to survive. Let's walk you through the steps and see what are the things we can do to possibly salvage or reattach a severed limb. First thing to do is pick up the limb or body part, wrap it in a towel and put it on ice and bring it with you. Then, as quickly as you can, get to a trauma center. So if there's a chance of reattachment, we can do that. When a person comes in as a trauma, the trauma team gets contacted and everyone rushes to the emergency room. Someone comes in, the hand is wrapped up, separately their body part that was cut off is brought in on a piece of ice. So we don't want it directly on ice. Usually you put it in a bag and wrap it and then put that on top of ice, but keeping it cold helps. Then we do our regular assessment, the ABCs, make sure their airway is patent, they're able to breathe, circulation is intact, put in IVs, check them and do primary survey, secondary survey, which is part of a trauma workup. Once they're identified, there's no other injuries, they're not bleeding out, then we can do third level or tertiary survey, look for other injuries elsewhere, chest x-ray, blood work is done at this point. They're typed and crossed for blood products in case they need them. And then once we've ruled that all out, now we can go to talk about replanting the hand. Now take it, all of these things are happening within a matter of a few minutes. So we're still in that vital time window of that 6 hours, but that 6 hours is critical. Within 6 hours, blood flow has to be reestablished if we want that body part to survive. So usually as soon as that person comes in, the operating room is activated as well, and they start setting up the OR. So once we're done with the trauma bay, then that person can go straight to the operating room if they don't need any other scans. In the operating room, they get intubated, go to sleep, and then the reconstruction begins. What are the steps to replanting a body part? In this case, it was a distal forearm. So the fact that it was a distal forearm and not across the wrist or the hand made it a lot easier because we're dealing with bigger structures. The bones are bigger, the vessels are bigger, tendons are bigger, everything is a little bit bigger, and the reattachment process is a little bit easier. So we start by fixating the bone first, plates and screws go in, it gets reattached, and that creates the foundation and structure. You can think of it like building a building. How do you build a building? You have to have foundation in place first, then plumbing, electrical, all that stuff goes into place. Same thing. So bone is fixed. Now, the time-sensitive stuff are the blood vessels. So we try to do that as quickly as we can, but it has to be done in the right order because sometimes you can't do the blood vessels right away if there are other structures under that blood vessel. In this case, blood vessels are on the side. We have the radial artery, the ulnar artery. So we can do that and not affect the nerves and tendons, which lie right in the middle or run through the carpal tunnel. Veins, arteries, both of those get fixed. As soon as we do the blood vessels, we check for the flow, make sure there's adequate blood flow. So something used Doppler checks for the blood flow can be checked to make sure there's blood flow in the hand because we're reconnecting here. Then the tendons get repaired, nerves get repaired, nerves first, then tendons because of the anatomy. And then you're done. We do one side and then we can flip and do the back side. So flexor tendons, they help flex hand, wrist, and fingers. And extensor tendons pulls back and straightens out the fingers and hand. So we do the blood vessels and the front side, the volar surface, and then flip and do the dorsal surface. Well, let's talk about what happened when someone accidentally cut off their hand. I had the pleasure and opportunity to work with a world-famous surgeon, Dr. Randy Sherman. Like we've talked about, the critical time window is 6 hours. What happened in this scenario? We had a young construction worker. Trauma was activated, which means in the hospital we had pagers that started going off that there was an accident. We all rushed down to the emergency room and they tell us what's the story. Some young 20-something-year-old male construction worker had a table saw injury and came across his distal forearm, so his entire hand had come off. As part of the trauma team, and I was going into plastic surgery and everyone knew this, and it was early enough in the day that this happened that I got to go and operate with him. So we took the patient to the operating room, he goes to sleep, and then we start the process of putting the hand back on. This is microsurgery that we're doing. So a microscope comes in, we look through the microscope in some cases. On these larger vessels, sometimes we don't need the actual microscope and we can use something called loupes. Basically microscopes attached to our glasses. And we look through those, so we don't need to bring the big machine in. It's much more mobile and allows us to move around a little bit easier. We reattach those, and then we go through one by one, each tendon individually, the nerves. Once we've reestablished blood flow, then that gives us a little bit of time so we can catch our breath, take a deep breath, slow down, and then the fun process of putting everything together. So for a general surgery resident, I was completing my general surgery residency at the time. This was a really, really cool process to be involved in. Terrible for the patient, but fortunately we were able to save his hand and put it back on. And just being able to do that by itself is an amazing experience. And then I got to do this with one of the most famous surgeons in the world at the time. Unfortunately, he passed away from a plane accident after this, but just to have that opportunity and have this story with living legend was amazing. And we saved this person. He had function of his hand again. So after the surgery, he gets splinted, but then does physical therapy rehab and regained ultimately function of his hand. Not 100%, but about 80%, which is amazing. And the benefit of it being his own hand putting back on, he doesn't need immune suppression. He just can go back blood thinners for a short period of time, but then after that resume a normal life. We talk about nowadays transplanting other people's hands. Then you need immune suppression because it's a transplant. You need to be on lifelong medicines, and there's risk associated with that. But the benefit of saving his own hand is you don't need any of that. So great outcome as a resident, an amazing experience, and kind of building blocks of who I am as a surgeon.